Hello dears, today we are going to discuss about pancreatitis. Being a very important endocrine and exocrine gland in our body, pancreas plays great important role in the metabolism of carbohydrate, protein, fat, and at the same time with the hormonal secretions, namely glucagon, insulin, somatostatin, and various polypeptide hormones. Pancreas plays great important role in our daily life, from minute to minute or hour to hour or day to day. That means each and every cell is regulated by the main hormone, insulin. At the same time, regarding the overview of pancreas, you can see there are so many cells were scattered in pancreas here and there, and such class of specialized cells are known as islets of Langerhans. These are the hormone secreting glands or endocrine glands. And at the same time, the pancreas is equipped with various other cells known as exocrine cells or exocrine portion of the pancreas. So, any infection or any obstruction or any other pathology which may affect the function of pancreas, and the presentation may be depending on the degree of infection, degree of pathology, area of extension, age of the patient or sex of the patient, and with various other factors. Regarding the disorders of pancreas, the pancreatic pathology can be mainly typed into three as acute pancreatitis, chronic pancreatitis, and chronic relapsing pancreatitis. Anyway, let us study about the cause of pancreatitis. Because without having any previous history of any infection or any issues, the patient may be presented with very severe agonizing acute symptoms, especially of pain, especially of vomiting, especially of shock. If our patient presented with such symptoms, usually the same may be because of obstruction of the head of the pancreas by gallstones. So, in our clinical practice, near about 30 to 60% of the acute pancreatitis is mainly affected by slipped gallstones. And other cause is alcohol abuse. Continuous and very heavy drinking of alcohol, or a patient may be an alcoholic, or the symptoms may be aggravated usually after a heavy meal with or without alcohol. So, near about 80% of, instead of gallstones near about constituted near about 30 to 60% only. And the same time, the abused alcohol beverage cause 80% of acute pancreatitis. Because when a person drunk with alcohol, the alcohol may get a direct entry into the head of the pancreas or into the pancreatic duct, and thereby biochemical interaction takes place between the alcohol and pancreatic juice, and the pancreatic juice finally converted like that to a plugs or clingers which block the head of the pancreas. That is why the pancreatic juice cannot get exit from the pancreas, and the same may forced kept inside the pancreas, and thereby the pancreas may become very edematous, very acutely inflamed, or a sloughing, or necrosis, or even hemorrhage can occur. That is why in our clinical practice, the acute pancreatitis may commonly seen in patients with alcoholics. And other cause may be due to various drugs abused by we people, namely known as NSAIDs or corticosteroids or other painkillers or analgesics, hepatotoxic drugs or nephrotoxic drugs, or drugs which are mainly used to elevate the pain. Common name of drug may be like that of over and diclofenac sodium citrate. So the pharmacological or the toxicological history may give a clue to the cause of acute pancreatitis, and at the same time the pancreas may be inflamed by various microbes, especially the bacteria or virae or even protozoa, or even in intestinal helminthiasis, especially by ascarids. And in some other cases, the infection or the inflammation of the pancreas may be due to some autoimmunity or immune mediated pancreatitis, or truly the pancreatitis may be purely idiopathic. That means it is very difficult to reveal the cause of pancreatitis. These are the main reasons behind the acute pancreatitis. So, pancreatitis is nothing but infection and inflammation of the pancreas. The same may be very mild or moderate or very acute or chronic or chronic relapsing pancreatitis, and the cause may be mainly due to obstructive pathology like gallstones, then infective pathology, then abuse of alcohols or abuse of drugs or autoimmunity or truly idiopathic. And next about the presentation of a patient with pancreatitis, that means clinical presentation. Dear students, that can be studied in next class. Okay, thank you. Bye.